Okay, Assalamualaikum warahmatullahi wabarakatuh and good day everyone. So today we're going to learn about the gross anatomy of the heart and also the mediastinum, but not much on mediastinum because I think this model is not suitable to learn about mediastinum. So if you want to learn about mediastinum, you can have a look at the atlas, okay, or complete anatomy. Alright, like what we have learned in the lecture, okay, this is where the heart is positioned, right? Okay, this is the thorax, okay? As you can see, this is the thorax. And if you remove the rib cage, okay, so this is the sternum, this is the manubrian sternum. Okay, if you remove the rib cage, you can see the heart here, right? So this is where the heart is positioned, okay? It is in the middle mediastinum, okay? Middle mediastinum. And if you look, if you put back this ribs, okay, and the midline, okay, you will see that, okay, this, just imagine that this is the midline, okay, you will see that 1/3 of the heart is occupied to the right side, where the other 2/3 is on the left side, okay. So you are actually looking at the anterior surface of the heart, okay, anterior surface of the heart, which is mainly formed by the right ventricle, okay, right ventricle. And if you look, if you remove the lungs, okay, if you remove the lungs, now you can see the whole structure of the heart, okay, right. Now you can see that more clearly that the heart is positioned obliquely to the left, okay, obliquely to the left. And remember, the heart has one apex here, okay, and if you palpate, it is at the 5th intercostal space, mid-clavicular line, alright. And it has 4 borders. So this is the right borders, okay. Right borders is vertical, okay, vertical, and it is formed by the right atrium, right atrium. And the left borders, okay, it's a bit oblique, okay, difficult to show you here because there's lots of structure here, but it is like this, it's a bit oblique, okay, and it is mainly formed by the left atrium, okay, left atrium. And the left borders here, it is here, okay, and this is mainly formed by the left ventricle, okay, left ventricle. And the inferior border, okay, if you can remove this one, inferior border here is formed mainly by the right ventricle and also the apex, okay. Alright. So about the surfaces of the heart, okay, as you can see, the one that you have seen just now is the anterior surface, and usually the anterior surface is mainly formed by, like I mentioned just now, by the right ventricle, but it is also formed by right atrium and also the left ventricle, okay. So that is the anterior surface. To show you the other surface, okay, I will show you this model. Okay, right? Okay, just now we have seen the anterior surface, okay, which is formed by the right ventricle, right atrium, and also the left ventricle, okay. And this is the apex, okay, and opposite to the apex is the base, okay, the base, okay, this is the base. Base is formed mainly by the left atrium. How do you know that this is left atrium? There is 4 veins entering these chambers, okay. So this is the main portion of the base of the heart. But remember, the base also is formed by the right atrium, okay, the right atrium. So this is all the base of the heart. And if you remember, the heart is positioned like this. So the one that actually sits on my hand, just imagine that my hand is the diaphragm. So this is the diaphragmatic surface, okay, diaphragmatic surface, and it is formed by the right ventricle and also the left ventricle, Okay, so this is the diaphragmatic surface. And what else? Okay, you have anterior surface, base or posterior surface, then you have the apex, and then you have the diaphragmatic surface, which is the inferior surface, and the other two is this one. Okay, the right pulmonary surface, okay, this is the right pulmonary surface, and the left pulmonary surface. Okay, left pulmonary surface. Okay, so the right pulmonary surface is formed by the right atrium, okay, right, and also a bit of the right ventricle, whereas the left pulmonary surface here is formed by the left ventricle. Yes, I forgot to mention just now, the anterior surface is not only formed by right atrium, right ventricle, and also the left ventricle, but it is also formed by the left auricle. Okay, that's all about the surfaces and borders of the heart. Let's have a look at the external features of the heart. Alright, so you know that heart has 4 chambers. Okay, this is the right atrium, the right ventricle, the left atrium, but you can only see the auricle here, the left atrium, okay, and the left ventricle. Okay, if you look from external features, the one that you must describe first is the sulcus. Okay, sulcus that are present at the external surface of the heart. Okay, there are 2 important sulcus. The first one is this one. Perhaps it's not really clear here. Let's look at the posterior side. So you can see this sulcus here. Okay, this is a sulcus that separates the atria, the 2 atria from the 2 ventricles. Okay, so this is the sulcus, okay, and it is circumferential, okay, right? So this is the sulcus, so we call this atrioventricular sulcus, okay, atrioventricular sulcus, and it is also known as coronary sulcus. Why? Because you can see this big vessel here. There is a big vein here. This vein is known as coronary sinus. Okay, so that is why this sulcus is also known as coronary sulcus. Okay, so anteriorly you can see a bit the coronary sulcus here, okay, and also here. All right, so what vessels runs in this coronary sulcus? Again, you have to look from behind. Is the of course the first one is the coronary sinus. The other one is the right coronary artery, okay, right coronary artery, and the other one is small cardiac vein, okay, small cardiac vein. Okay, and the other sulcus is this sulcus here. Okay, this sulcus separates the 2 ventricles, and it is present at the anterior part of the heart, so known as the anterior interventricular sulcus. Okay, but it actually continues to the posterior part, but at the posterior part, the sulcus changed its names into posterior interventricular sulcus. So what arteries and veins that are present in this sulcus? Okay, for anterior interventricular sulcus, there is one artery here. This is anterior interventricular artery. Okay, anterior interventricular artery. And for the vein, this is the great cardiac vein. Okay, great cardiac vein. Okay, if you go posterior, okay, posterior interventricular sulcus, the artery is the posterior interventricular artery and the middle cardiac vein. Okay, middle cardiac vein. Alright, that is one feature. Let's discuss about the external and internal features of each chambers. Okay, let's concentrate on the right atrium first. Okay, if this is the right atrium, if you open the right atrium like this, so you can see lots of structure inside the right atrium. But before that, externally, there's one important structure that you must know, which is this structure here. this is called right auricle. Okay, right auricle. It looks like the left auricle, and this right auricle, it actually overlaps the pulmonary trunk. It actually overlies, it overlies the pulmonary trunk. Okay, pulmonary trunk. And there is one important sulcus at the right atrium, which is not really visible here, but I can show you. The sulcus extend from, this is superior vena cava, and this is the inferior vena cava. It extends from superior vena cava to the inferior vena cava. So this is the sulcus. Sometimes in exam, I put a dotted line here. Dotted line using stickers, okay? So I'll ask you, what is the sulcus? So this is the sulcus terminalis, okay? Sulcus terminalis. Why is it important? Because it is an important landmark for one structure that is located here, which is the sinoatrial node, okay? Sinoatrial node. Alright, another important thing is that if you look from internal, okay? Look from internal, okay, the sulcus, okay, actually correspond to a crest inside. So, okay, outside it is known as sulcus terminalis, but inside this crest is known as crista terminalis. Okay, crista terminalis. So why crista terminalis is important? Crista terminalis is actually also an important landmark because it separates the rough part, okay, where you have the muscle here, and the smooth part of the right atrium. Okay, I'll talk about this a little bit while afterward. Okay. Alright. So, okay, what else? Okay. So, okay, this rough part, okay, this rough part of right atrium, okay, it is occupied by this muscle, which is pectinate muscle. Okay, can you see? It's the pectinate muscle. It occupies the anterior wall of the right atrium. So this is anterior, you open, so you are actually looking at the anterior wall of the right atrium. Whereas the smooth part behind there is actually the posterior wall of the right atrium, okay, posterior wall. So this smooth part is known as sinus venarum, okay, sinus venarum. It is not sinus venosus. Sinus venosus is an embryological structure. Okay, so this is sinus venarum. Okay, and the other thing that you must describe is the interatrium septum. Interatrial septum. So this is the interatrial septum, and one that separate the right atrium from the left atrium. There, left atrium. So this septum, there is one important structure present here. This is an embryological remnant. So this structure is the fossa ovalis. Okay, fossa ovalis. It is the embryological remnant of foramen ovale. Okay, and you can see that I'm pointing at the floor of the fossa ovalis, and the edge of the fossa ovalis is the limbus. Okay, limbus of the fossa ovalis. Alright, what else? When you want to describe about the chambers, you must also describe the openings, okay? Openings of the heart or orifice that are present in that chambers. Okay, for right atrium, there are several openings. This opening here is actually opening or orifice for superior vena cava, because superior vena cava carries deoxygenated blood from head and neck and myocardium into the heart. So this is the opening. And the other opening is here. If you can see here, this is actually opening of the inferior vena cava. Okay, inferior vena cava. So it opens into the right atrium where it carries the oxygenated blood from the other parts of the body. Okay, mainly the body, the lower parts of the body. And apart from that, there is another opening here. Okay, if you can still remember the largest vein, the coronary sinus just now, okay, which is this vein, okay, this vein also carries this deoxygenated blood into the right atrium. So this is the opening of the coronary sinus. So that is where blood enters right atrium through this three main orifices. But remember, there are other small orifices which is present at the wall of the right atrium, but it's not really shown here. So but you just remember that is actually opening for vena cordis minimi. But don't worry, what you need to know is just remember the three main opening, major opening: superior vena cava, inferior vena cava, and coronary sinus. And the blood flows into the right ventricle, okay, by passing through this orifice here. This is the right atrioventricular orifice, also known as tricuspid orifice, okay? Okay, tricuspid orifice, okay, the name follows the name of the valve, okay? But if you mention right atrioventricular orifice, it's also correct. Okay, now let us discuss about the right ventricle. Okay, right ventricle, okay, this is the right ventricle. Okay, nothing much from the external. When you were asked to describe the external features of the right ventricle, meaning you just describe the surfaces, you know, the borders, that's all. But right ventricle is mainly described. If you want to describe right ventricle, is more on the internal structure. Okay, so when you open this one, now you can see that this is the structure at the anterior wall of the right ventricle. I put this down first. Okay, how do you know which is which? You look at the, okay, of course, it's like this. When you put like this is the right ventricle, right? This is the right ventricle. And you look that the wall here is thicker. Okay, thicker meaning that this belongs to the left ventricle. Compared to this one, okay, it's thinner, right? So wall of the left ventricle is thicker. And when you look at this interventricular septum, okay, it bulges towards the right ventricle. Okay, it bulges towards the right ventricle. So when you do a cross section, the chamber of the right ventricle is crescent shaped. Crescent shaped. Okay, so this is the right ventricle. So you can see this muscle here in right atrium is known as pectinate muscle, but in ventricle it is known as trabeculae carneae. Okay, trabeculae carneae. Be careful with the spelling. When you answer OSPI question, make sure you get the spelling right. Okay, so I put this now. Let us discuss the other structures of the right ventricle. Okay, one important thing that you need to know is this outflow tract. Okay, the muscle just now, trabeculae carneae, forms the rough part of the right ventricle. Okay, this is the rough part of the right ventricle. And what forms the smooth part of the right ventricle? Just like the atrium just now, it also has right and rough and smooth part. The right ventricle also have smooth part. This is the smooth part. It is known as conus or infundibulum. Okay, conus or infundibulum. This is the outflow tract of the right ventricle. Okay, the smooth part is the inflow part. Okay, the inflow tract. Okay. The rough part is the inflow tract, the smooth part is the outflow tract. So this is the conus or infundibulum. Okay, and the one important, very important structure that you need to describe is of course the valve, right? So this is the tricuspid valve. Why tricuspid? Because it has three leaflets. How do you know? You know that the valve, the leaflet, actually connected to the papillary muscle. As you can see here, this is the muscle, right? Leaflet connected to the papillary muscle via chorda tendinae. Okay, this is chorda tendinae. And there are three leaflets. So, how do you know? How do you name the leaflet? It's according to the position. You know this is the anterior papillary muscle because it is present at the anterior wall. So, the anterior papillary muscle. So, the cuff that is connected to the anterior papillary muscle is the anterior cups. This is the septal papillary, okay, septal papillary muscle. So, the cups that is connected to the septal papillary is the septal cups. And behind there, if you can see, can you see? Alright, so that is the posterior papillary muscle, okay. It is connected to the posterior cups, okay, posterior cups. So all these structures, okay, these two structures, the cups of the tricuspid valve and the papillary muscle, they are connected by cords of fibrous tissue known as chordae tendinae. and the contraction of this muscle and the tautness of this chorda tendineae, okay, will controls the opening and closure of the papillary valves. And there is another one important structure. As you can see here, this is the anterior papillary muscle that is connected to the septum. Okay, I forgot to mention this is the interventricular septum. So the one that connected to the septum here, okay, is known as moderator band. Moderator band. So what is inside the moderator band? It is the right bundle branch of AV bundle. Okay, right bundle branch of AV bundle. So from AVN, it goes into the moderator band. Okay, so again, moderator band is actually the anterior papillary muscle that is connected to the interventricular septum. So this is the structure. Okay, and other than that, what else? Okay, all right, there is another valve here. This, can you see the valve? Okay, this is, if you look from anterior, of course, you can see the pulmonary trunk. Okay, pulmonary trunk. So this valve here is the valve of the pulmonary. This is the pulmonary valve. Remember, this is not atrioventricular valve like tricuspid valve. It is the semilunar valve because the cups, the shape of the cups is semilunar. If you look from above, it's like a cups. Okay, semilunar. And you have to know how to label the cups. Okay, this is according to the position. So if you look here, this is the anterior. So the one that is anterior most is the anterior cups. Okay, this is left cups. This is the right cups. Okay, all right. I think that's all for the right ventricle. Let's move to the left atrium. Again, left atrium. From anterior, not much to discuss because what you can see is only the left auricle. This is the only rough part of the left atrium. Okay, so you have the pectinate muscle inside this part, very small part. But left atrium, okay, mainly is from, I have to remove this one first. Oh, okay, mainly is from, the wall of the left atrium is mainly smooth. Okay, mainly smooth. Okay, only the pectinate muscle, this part only rough part, the other part is the smooth part. And what else that can you see inside the left atrium is, if you look at the interatrial septum, you can see a depression here. The fossa ovalis can also be seen from the left atrium. Okay, and externally, what is important is that it is being it received 4 veins. Okay, 4 veins. This is the right superior and inferior pulmonary vein. This is the left superior and inferior pulmonary veins. And you can see that it's in this model, it's red in color, meaning that it received oxygenated blood. Although the name is vein, but it carries oxygenated blood from the lung into the heart. Okay, so there are 4 veins here. That's all for the left atrium. Alright, let's talk about the left ventricle. Okay, just like the right ventricle, left ventricle also have the rough part and smooth part. Okay, the rough part is occupied by the tuberculae carni muscle, whereas the smooth part is here is actually the outflow tract, and that is known as aortic vestibule. Okay, vestibule. Remember, the right part, the right ventricle, this is known as conus. Conus or infundibulum, okay, the smooth part. But for the left ventricle, this is known as aortic vestibule. Okay, it goes towards the aorta. Alright, and it also has atrioventricular valve, which is the mitral valve. Okay, mitral valve is also known as bicuspid valve because it only has 2 cups. Okay, 2 cups. This is anterior cups. Anterior cups is connected to the anterior papillary muscle via chorda tendineae, and posterior cups is connected to the posterior papillary muscle also via chorda tendineae. Okay, chorda tendineae. And you can also see that the wall is thicker compared to the right ventricle. Okay, and the left ventricle actually is connected to the aorta, okay, via this valve here. Okay, this is the aortic valve. Okay, aortic valve. It's also a semilunar valve, and it has 3 cups. Okay, 3 cups. So this is the posterior cups. Okay, this is the right cups, and this is the left cups. Okay, so I think that's all for gross anatomy of the heart. If you have any question, okay, you can just email me or come to see me when you are here. I think that's all. Thank you so much. Assalamualaikum warahmatullahi wabarakatuh. Bye bye.